Delighted to welcome you to this afternoon's session where we're going to be focusing on end-of-life care. So moving on from this morning's detailed session around the Cancer Action Team's work programme and support for commissioners to now thinking and focusing on end-of-life care and again to think about the challenges, the priorities and importantly for us as a national programme to hear from you how you think the programme can best support you in taking this work forwards within the new commissioning arrangements. I'm going to be joined this afternoon by colleagues who are going to be talking also about service innovation, service improvement, and in particularly looking at things which really are connecting across organisational boundaries, because particularly from an end-of-life care services perspective, this is about how we join up services and how we make things work for individuals across a care pathway, and how do we commission that. So I'm going to be joined this afternoon by Dr. Catherine Millington-Saunders, who's going to be talking about Coordinate My Care, around looking at the electronic transfer of information to members of the multidisciplinary team so that we can ensure that the right information is received by the right people at the right time to deliver the right care in the right place. And I think that's going to be hugely important for us to hear about how that's now being taken forward across London. We're also going to hear from Professor Rob George, who's going to talk to us about the practicalities, again, around do not attempt a cardiopulmonary resuscitation, but in particular, how does that work across boundaries and what does that mean for us in terms of commissioning, the importance of that. We're going to hear from Dr. Nigel Sykes, Medical Director of St Christopher's Hospice in London, who's going to talk to us about integrated end-of-life care and cancer systems. So very much looking forward to hearing from Nigel this afternoon. And then we're also going to be joined by our colleague, Dr. Steve Styraker from NICE, who's going to talk to us about the NICE quality standard for end-of-life care, which was published in November 2011. So we've already heard about the important role of NICE this morning in terms of the commissioning landscape and us moving forwards. And for us within the end-of-life care programme, absolutely delighted because the end-of-life care quality standard builds on the work of the quality markers that the Department of Health produced and published in 2009. So it really gives us that next step forward now. And I think, although we heard that word aspirational this morning in terms of the NICE quality standard, I think when we think about what's important for end-of-life care and what does good look like, what we're really thinking about is actually, what is it we should be providing for each and every person towards the end of their life. And I think also Steve's going to talk to us about the NICE commissioning and benchmarking tool, which was also produced and published in 2011 in December, and that is there to support commissioning going forward around end-of-life care. So I'd like to kind of set the scene this afternoon just by taking forward an overview session and really to kind of set the context, and then I'm going to hand over to colleagues. We're also going to have a chance to have an interactive session again this afternoon. I'm going to get a chance to play, or you are, with the iPads. I've always wanted one. I still haven't got one, but I think hopefully that's going to be, again, our opportunity to hear back from you in terms of feedback around how we can really continue to provide the right support to take forward end-of-life care commissioning. Thank you. So I should have also said that in terms of the end-of-life care programme, our remit specifically is around supporting practical implementation of the end-of-life care strategy for England, and very much that's about working in partnership. So again, I think, when we come to think about, who does end-of-life care impact on and whose business is it, well, each and every one of us and all of our business. And so actually, again, from the point of view of this afternoon, delighted that this is a partnership presentation because it's around our leadership across the whole of the system in taking this work forwards. So I think, just in terms of the challenge, and again, I know this will be very familiar to many of you here, but just looking at the actual deaths and the projected deaths going out to 2030, and I think, again, you can just see that steep increase there. So, actually, we know about this demographic challenge, we know about this change in the population and the ageing population, but, actually this imperative for us to really be acting now, because this is increasing from now, and actually how do we make best use of our existing resources and services. So this is looking at the increase in deaths to out to 2030, and really looking also at the demands not only from individuals and the public, but you know, actually our political imperatives and financial imperatives about best use of resources. Again, the ageing population, and we're all well aware of this. I think this, you know, we're all hearing this, but I think this slide's quite interesting just to note the green bar at the bottom, the increase in the older proportion of the older age group, so the aged 85 and above. So, and what does that mean for us? Well, I think, you know, as Stephen said this morning, end-of-life care services is not just about cancer. Increasingly, this is about care of the frail elderly. This is about people with dementia. This is about people with multiple comorbidities. And, you know, what are those challenges for us in commissioning those services and in supporting people in those later years of life and ensuring that we can provide the best services possible. We've talked a lot this morning about the changing landscape, and again, I think, you know, building on the best in 2003, the end-of-life care programme really, in those earlier years, focusing on rolling out those good practice tools across services, so actually supporting and working to implement gold standards framework within primary care services, preferred priorities for care, and again, you know, we're going to hear more about that as we go through the presentation around Liverpool Care Pathway for the Dying Patient. So actually building on the best was hugely important to get end-of-life care on the landscape. And then, of course, in 2008, we had the end-of-life care strategy for England. So the first time, again, that we've had a blueprint across the country about raising the profile and the importance of end-of-life care services. You know, we came from a very low base in this country in terms of where it was recognised and really who was receiving services. And again, historically, as all of us will know here, you know, we've been pretty good at looking at supporting people with cancer around end-of-life care, but what about those with other conditions? The present government and the coalition government gave commitments again towards supporting end-of-life care in terms of looking at taking forward a palliative care funding review, helping to look at funding systems to support palliative care, and also to work towards what it calls a national choice offer, but actually to really support the continuation of the work of the end-of-life care strategy. And again, you know, not to labour the fact, but we are all in this transition, and I think one of our critical ambitions at the moment is to ensure that the huge amount of good work and momentum that has been taken forward in the last 4 years since publication of the strategy and the practical implementation continues, so that leadership and that knowledge and that continued work, as we've seen, you know, that demographic challenge is going to remain there for us. So, where will end-of-life care be commissioned? And again, I'm not going to stand here with those answers today, but I think this is something to come on to for the table discussions to consider, because when we think about what we're talking around with end-of-life care services, so many of us have a role in that, in terms of both providing those services and again in terms of levels of commissioning, levels of service that are required. You know, we're looking at a whole range of services, from primary care services, we're looking at specialist palliative care teams, we're looking at transport services, we're looking at equipment. You know, how do we understand that? And within the new landscape, how does that work? How does it work across health and social care? Because end-of-life care is very much around health and social care. It isn't sitting in a health domain. Where is it going to be commissioned in terms of alignments? You know, again, it's long-term conditions, older people, dementia, frailty. How do we understand where it fits and not lose it in the context of what it really means? Heard a lot this morning about the National Cancer Intelligence Network, and hugely important for end-of-life care, the National End-of-Life Care Intelligence Network, again a commitment in the strategy. And again, we've just published a report, what we know now that we didn't know a year ago. Hugely important work that Dr. Julia Verne, the clinical lead of the Intelligence Network, and the team at the South West Public Health Observatory have been undertaking, which has been about beginning to really have meaningful intelligence around the information and data sources, because again, disparate data sources, but now beginning to link the HES data, the ONS data, to really look at the social care data and what does that begin to tell us. The Intelligence Network has just published PCT profiles, with profiles on there around local authorities, but they have just published some new information, which I have to hold my hand up and say I have not looked at myself yet, but I will be doing, and just would urge you to do that, because that is very new, hot off the press. And again, from the programme perspective, to talk a little bit about what we've been doing to support really sharing good practice, developing those service innovations, testing those service innovations, and then really supporting spread of innovation. And working with information for commissioners, so that's building on some of the work we've previously been undertaking, and now in particular our role in supporting the NICE quality standard and commissioning guidance. I've put the palliative care funding review there, but I'm not going to talk too much about that today, except to say that there are pilot sites now underway across the country for the next 2 years that will be focusing on understanding the data in terms of palliative care services, both within the community and in inpatient episodes in hospital. So again, I think many of us are familiar with this slide, but I think it's always a really good reminder, because as much as we may be fragmenting in some respects in terms of numbers of individual commissioning organisations and arrangements, really end-of-life care and the strategy was about a whole systems approach, and it was very much about those core elements that will impact and make a difference. So that work at a societal level about breaking down that taboo, you know, what are we most fearful of? Well, actually talking about death and dying, and that awareness in society. At an individual level, what does that mean in the context of integrating services, and for an individual, what does that mean? And what does it mean for the workforce? You know, 2.5 million health and social care staff working across services, and very few of those will have no contact at all with an end-of-life care pathway. And the importance of research funding, and again, the role of the programme in providing implementation support. Again, familiar slide to many, but I think, you know, that reminder that actually we are talking about a pathway of care. We're not talking about a linear pathway. We're talking about the quality of services in all care settings, and we're talking about actually, well, where is that person's preferred priority for their care and place of care. And again, importantly, those cross-cutting themes. So actually social care and the involvement of social care, where does that fit with commissioning and health and wellbeing boards? Spiritual care, support for carers, information and support for individuals and families, of voluntary sector and communities, so the whole spectrum. So what does good look like? I'd just like you to, just for one moment, just to close your eyes. I think end-of-life care and what does good look like is something that's very personal to each and every one of us, that we will all have, as professionals, cared for somebody who has died, but again, as individuals, have you know, family members, friends that we've loved and lost. So just for 1 minute, just to close your eyes and just think, actually, you know, what does good end-of-life care look like? If I can ask you to do that, please. Okay, well, thank you. I think it's individual, isn't it? It's personal. It's not about just what it looks like, it's how it feels. And so I think, you know, when we think about end-of-life care services, it's about that individual. It's very much person-centred. It's what's important to that individual. It's about optimising and caring for symptoms, isn't it? And actually that's really, really important. How do we do that? How do we communicate? I think, you know, we know that one of our biggest barriers is that conversation, having that conversation. And I think for me, you know, we hear a lot about the difficult conversation, and I think all the while we call it the difficult conversation, I think as professionals we can make it the difficult conversation. I think what we know from our work with individuals and service users and carers is that they really would like us to have these conversations, and that it's how we start. It's not a one-off, it's, you know, how do we continue that conversation. And I know that my colleagues this afternoon will also be talking about that. So what does good end-of-life care look like? And why don't we always meet an individual's needs and choices? Why are they not always met? Well, I think, you know, again, simply it's about, well, whose responsibility is it? You know, not identifying that perhaps somebody is in that last phase of life. And I think, you know, the strategy talked about that last year. But if we think about a person with dementia, we might be talking about, you know, much more than a year. And actually, what's the appropriate time to have those conversations when perhaps that person is able to really make those informed choices about what's important to them and where, what their preferences would be at the end of life. Services not available, access to services. Individuals and carers actually been unaware of what's available, what's out there in the community, what can support. And professionals being unaware of the benefits of some of those services. So actually, again, very much a partnership, a multidisciplinary and an interdisciplinary approach across health and social care. You know, what is the role of our colleagues? And I mean, interestingly, how many colleagues here today work in social care? Yeah, so we have no colleagues here today from social care, and social care is a key component of end-of-life care, hugely important. So again, you know, how do we understand that if we're thinking about commissioning end-of-life care services? And not only do we not communicate, as we know, with individuals about end-of-life care, how do we transfer important information about end-of-life care to our colleagues in other services? And I know that both Catherine and Rob will be talking about that this afternoon. And really, what's the experience of care? Well, the National Voices Survey, so the survey across the country of understanding bereaved relatives' experiences, has just been completed. And hugely impressive return on that. I think we've had over a 40% return on those questionnaires that have gone out nationally across the country, which just demonstrates how important this is to people. And we're expecting that report in July, again, which from a commissioning perspective will really give insight into what's important to people and the impact of that. And there's work ongoing around near real-time patient experience, and certainly there are areas in the country that are getting very close to understanding how we can access feedback in real time from patients. And people do think, well, can we do that at end-of-life care? Well, we absolutely can. I need to speed up. I'm just keeping one eye on the clock. End-of-life care is a QUIP work stream. Again, it's, you know, the end-of-life care commitments in the strategy all about quality. If we get the quality right for end-of-life care, actually we get the productivity. You know, we're looking here at, we talked about costs this morning, and understanding costs in the system. How can we commission if we don't understand costs? I think we're getting a little bit further there, but we've still got lots of long way to go to really understand cost of end-of-life care services. And again, thinking about the prevention. So, you know, actually thinking about good end-of-life care and care after death and into bereavement. So, you know, thinking about the impact of not having support after death. What does that, you know, how does that impact on productivity, you know, in the workplace and services? We have got key performance indicators. Again, nationally, we've got the death in usual place of residence. We've got 5 hospitals across the country just about to start working on testing the KPI 2, which again is around the number of hospital admissions of 8 days or more which end in death, based on clinical need. And again, some of you will remember the National Audit Office report in 2009, the work in Sheffield, which identified 40% of the people in hospital did not have a medical need to be there. So actually could we have supported discharge? And again, you can see the percentage reduction there in cost of bed days and the potential savings there that can be made by actually looking at improving the length of stay if there's no clinical need for that person to be in hospital. We're testing that because that's really important, that actually that doesn't become a tick box exercise. Let's discharge this person because we need to meet a target. This is not about that. It's about us understanding, what will this work in practice? What perverse incentives could it potentially create? And KPI 3, which will be a dashboard, again in under development with the intelligence network, around reducing emergency admissions in the last year of life. And again, we know there are complexities around that, so this will not be a single indicator. Where are we now? Again, I think I need to probably speed up, but looking at improvement, we are definitely making improvement. This is data from 0809 to Q2 11-12, and you can see that increase in death in usual place of residence. Again, across the country, variation, but you can see all areas of the country, the green box at the top there, key improvement in terms of achieving that death in usual place of residence, so supporting choice. Again, you can see here on my right-hand side here, London, again, that does have still below average achieving the death in usual place of residence, of the line across the country, but actually has got the highest increased improvement. So again, actually those interventions and partnership working starting to impact across London, which is hugely impressive. So focusing on QIP, and again, I really do need to speed up, but Dying Matters, again, we've got colleagues here from the Dying Matters Coalition today sharing the work of the Dying Matters, which is very much about public awareness. We've just had the Public Awareness Week around Dying Matters, and again, urge you to, if you do nothing else, to look at the DVD, I Didn't Want That. Again, it's very powerful. If we don't know what people want, how can we make sure that they don't get what they didn't want? And that's equally about all of us, making sure that we're making those preferences known to our family, friends, as we're going forwards. The Find Your 1% campaign, again, really just, the 1%, I know we could have lots of discussion about that, but this is about how do we identify those people in that last year of life? And having done that, what do we then do? So, how do we optimise care for those people on a GP practice list who are in that last year of life? And again, how are we encouraging and working beyond historically what may have been captured on a supportive care register in a GP practice around patients with a cancer diagnosis? So how are we identifying all those patients, and then what does that mean? Initiating advanced care planning, and we're going to hear about aspects of that this afternoon. EPACS, that's around electronic palliative care coordination systems, and really that's around coordinating care using electronic information systems. Catherine will talk more about that. Providing evidence-based tools, again, a lot of the work of the programme has been about developing that with social care, with partners in the NHS and NHS Improvement, and with the intelligence network. Talked about Dying Matters. Again, please pick up information if you haven't already seen that. Again, I think, from a commissioning perspective, where are assessments happening? Who has the skills and expertise to undertake a holistic needs assessment for your patients identified on this end-of-life care pathway? Planning for your future care. We've got lots of information resources designed to support providers, but equally from a commissioning perspective, how do we think about commissioning this, and where are those people in the system that can undertake these, these services and have these skills and competencies? Again, end-of-life care across all care settings. The Routes to Success series provides that kind of guide across all areas and really looks at those touch points between care homes, hospitals, the community, domiciliary care, and again the professions, so the role of different professionals, allied health professionals, social care, ambulance services, transport services. What does it mean? What does end-of-life care mean for individual professionals and in the context of the care setting and the transitions between those care settings? So, these guides have been designed with people working in those areas, with organisations working across those professional groups, and again, sharing that information of good practice and adoption of good practice. We shouldn't be reinventing these wheels, and I think, again, this is, somebody said earlier on, we have, it's about us understanding our local data, absolutely, and then it's about how do we also pick up and adopt and adapt good practice to meet those needs. 26 hospitals across the country currently working with the Transform programme. Again, that's about how do we put into place systematic and reliable end-of-life care systems and services to support. And, you know, remembering this is always about the individual, but actually from a hospital perspective, you know, what are those enablers? Again, delighted that we've got Dr. Irene Carey here with us today from Guy's St Thomas's. So again, with the Amber Care Bundle, actually, how are we starting to work in an acute hospital, managing people with uncertain recovery? You know, where are we starting to have those conversations for many of those patients that come in and their recovery is uncertain? So where are we starting to think about those transitions? Advanced care planning, care communication, coordination and communication. Talked about the workforce. Again, there's lots there. Again, from a commissioning perspective, you know, education and training. Now, how will clinical commissioning groups take that forward? What makes good sense? You know, what makes good sense about looking across the CCG clusters, about how we commission education and training, how we work with the new local education and training boards around end-of-life care. And just to reference Finding the Words, because again, we talked about communication skills. Finding the Words was produced by our service users and we worked with the key advanced communication skills teams, the Maguire Communication Skills Unit. And this is a series of DVDs in sections and a reflective workbook. So from an individual perspective and or group perspective, it's a very useful, again, training resource. E-learning for end-of-life care, so again, freely accessible across health and social care, 135 20-minute sessions on all aspects of end-of-life care, so looking again at symptom management, communication, advanced care planning. Where are we now? Well, we are turning our attention to looking at how we best go forward and continue to provide programme support. We are, again, thinking about how do we best make our resources accessible? There's lots and lots out there. We're working with thinking about the clinical commissioning cycle. And again, this is about complementing the NICE commissioning guidance and benchmarking tool. It's not about commissioning guidance, it's about practical implementation. And we'd like to hear more about that in the interactive session. I think we've talked about this. And I think the intelligence network, again, my colleagues in the intelligence network, again, over the last 2 years have produced a huge range of important thematic reports, again around the variation in deaths across the country, but also by particular disease profiles. So again, urge you to look at the Intelligence Network website and again to look at that from the perspective of what does it say nationally, but also what does it provide locally. So in summary, because I'm very over time, we also took forward a piece of work across 7 PCT areas across the country and published this report around critical success factors for delivering high-quality end-of-life care services. It's on our website, and as you can see here, it highlights, they're not in a ranked order, you know, but I think it's, again, about us thinking now, you know, we've built this momentum. Actually, we have got really you know, we've got improvement beginning to take shape across the country. We're seeing that change in direction of travel for the trajectories and supporting care. But actually, how do we maintain that? And thinking about commissioning, you know, where does this factor into the new commissioning arrangements? We have a programme newsletter which we produce monthly electronically, and also the Intelligence Network, as I say, website addresses there and phone numbers. So we're going to go forward this afternoon, and when we have the interactive session, I think to think about those success factors and what else can we now do nationally to provide that support. So I know I'm over time, but I'm going to stop there, and I'm going to now hand over to Dr. Catherine Millington-Sanders, who's going to talk to us about Coordinate My Care. Thank you.